Hi everyone, welcome back to the show on Wellness Before Illness. I am your host Dr. Anandu Vijayan, a dentist. Today we are discussing about precancerous lesions on mouth. Today we are talking about something that sits right under our nose or rather inside our mouth but rarely gets the spotlight it deserves until it is too late. We are diving into oral cancer, specifically how catching early warning signs can quite literally save your life. Most people think oral cancer just appears out of nowhere as a painful lump, but the truth is your mouth often tries to give you a heads up weeks, months, or even years in advance. Doctors call these warning signs potentially malignant disorders or precancerous lesion, which include oral leukoplakia, erythroplakia, and oral submucous fibrosis. Think of them like a yellow traffic light. It is not a red light yet, but it is telling you to slow down and pay attention and act. Let's break down exactly what you should be looking out for. The two most common precancerous lesions are leukoplakia and erythroplakia. Leukoplakia. The white patches often starts as a smooth, flat, white patch on the inside of your cheek or tongue. Over time, it can look like a homogeneous white area or it can become rough, bumpy and speckled. The trick with leukoplakia is that it cannot be scraped off like a normal fungal infection. Erythroplakia, the red patches, is less common but much more serious. It presents as a bright, fiery red patch because it lacks the protective white keratin layer. It has a much higher rate of transforming into actual cancer. Now, there is another condition heavily linked to specific regional habits, especially in Southeast Asia, known as oral submucous fibrosis. It is caused by chewing arachnid or betel nut regardless of whether tobacco is mixed into it. What happens here is unique. The inside of the cheek loses its elasticity, the tissue begins to fall tough, leathery, and develop palpable fibrous bands. Visually, the mucosa takes on a pale marbled appearance. The primary symptom people notice is a progressive inability to open their mouth fully, accompanied by a burning sensation when eating hot or spicy food. The malignant transformation rate for this condition over a 10-year period is around 8%. So what happens if you or your dentist spots on this red or white patches? Do we panic? Absolutely not. The clinical protocol is incredibly straightforward and reassuring. First is eliminate the cause. First, a dentist will identify and eliminate any possible local causes. This could mean soothing down a sharp tooth cusp that is constantly rubbing about your cheek, adjusting a rough denture, or most importantly, stopping tobacco or arachnid habits. The 2-week rule. We observe the area for 2 to 4 weeks. If the patch was just a traumatic irritation, it should show a good response and begin healing. Next is biopsy. If there is no response and patch remains unchanged, the next step is a simple diagnostic biopsy. This allows specialists to look at the tissue under a microscope to check for cellular changes like epithelial dysplasia, so a definitive treatment plan can be made. The takeaway for today is incredibly simple. Early detection turns a major medical crisis into a manageable bump in the road. When caught in this precancerous stages, the prognosis is excellent and the treatment is vastly less invasive compared to oral cancer surgery. Don't wait for pain. Spend 60 seconds once a month looking at your gums, tongue, and inside of your cheeks in the mirror. If you see an unusual red or white patch that stays there for more than 2 weeks, book an appointment with your dentist. Your mouth is talking to you. Make sure you are listening. Thanks for tuning into, and until next time, keep smiling and stay healthy.